Ladies and gentlemen, welcome back. This is the BS Machine. You are listening to episode number 74. I think it is 74. Holy moly. Have I got a treat for you guys today? I've got an epic guest on. Before I even introduce him, I just want to let you know how I met this epic person. Obviously, you guys know I teach a bit of yoga around Melbourne, and this incredible dude just started rolling up to my classes, and we ended up having a chat. After talking, him and his wife used to come to my classes, and one thing led to another, and I actually found out this guy was a proper like cardiologist, heart surgeon, I became really interested in his name's Peter Kistler, and I became really interested in sort of what he does and how things sort of relate with the heart, with yoga. And then we just got on to actually sitting down and having a chat. And I asked Peter to come on the podcast so we can really get into the nitty gritty of, I guess, the physical medicine around spirituality and yogi, stress reduction and things like that. So I'm so honored to have Professor Peter Kistler from the Alfred Hospital and Baker Institute on the podcast. Professor Peter Kistler, welcome to the BS Machine, mate.
Thanks so much, Tommy. It's a real pleasure and an honor to be here.
Love it, man. Love it. So, Peter, just even before, let me introduce you properly, because you're not just any sort of heart surgeon or any cardiologist. You head up the electrophysiology department and at the Alfred. That's at the Alfred, yeah, and Baker's Institute, yep. And this certain department actually studies the rhythm of the heart and the heart's rhythm. And so, before we dive into the actual physiology and things like that, can you just tell us how the heck does someone actually land and become a heart surgeon? Like, tell us.
So, it's a long old journey. So it's high school doing pretty well there, and then university, which is when I did it was 6 years of medicine, and then you do like a general medical training or general specialty training, which goes for sort of 4 or 5 years. And then you do cardiology training for 3 years. And then I did a PhD for 3 years. And then when I went over to London for a couple of years doing postdoctoral research with a red hot guy over there. And then, came back about 15 years ago and sort of run the clinical and research program at the Alfred and Baker.
Yeah. And do you know what I was thinking, just as you're talking then, what I was thinking about then is what it must be the first time you walk into an operating theater and the first time you're about to open up someone's chest and by then you've probably seen others do it and whatever else. But do you remember that first time when that happened with you? I'd love to hear that story.
Yeah. So all of my work is actually done through tiny little holes in people's right groin. So it's like a little porthole. Rather than, the true cardiac surgeon, as you say, is the one that opens up the chest.
Yeah.
So all my work's done through those tiny little portholes. I put pacemakers and what are called defibrillators in, which give people a shock if they suddenly drop dead. And that's sort of a little bit of surgery. But mine's not the big open chest kind of stuff. But it's just it's kind of a slightly nerdy specialty, because even your average cardiologist isn't really interested in this stuff. We look at these tiny little squiggles on a page and we have all these different technologies floating around. So but it's pretty cool.
Yeah. And okay, so then the first time you actually went through someone's right groin and that was the first time when it was like everyone else is gone. It's all on Professor Peter Kistler. What was that like? Where that first time you're like, holy shit, I'm actually doing it.
Yeah, no, I do actually remember that really well, because it was at the Alfred Hospital, and I've been in London for a couple of years. Came back and there'd been a guy there before me, but we were doing this new procedure where you actually have to punch a hole in the middle of someone's heart. And you're shooting for about a 5-cent coin size. And if you go off skew, if you go one way, the person, we have to call the cardiac surgeon to open their chest and pull the tube out. If we go the other way, then we have to put a tube under their breastbone and drain all the blood out that way. So we're kind of shooting for this spot. So yeah, no, I still remember that really clearly, the kind of the pressure. And I suppose you just trust in the training that you've had. And medicine is it's very much an apprenticeship. I mean, a bit like when we did that stress and yoga thing together, and you got to meet Louise, who's doing her PhD with me. And it's very much, like, she's learning to get on the tools, so to speak. And but yeah, no, you kind of you do have faith in your training, and it is very gradual in terms of the responsibility that you get, and then eventually you fly solo.
And do you feel like, because you would always feel like someone's life is in your hands?
You definitely feel the well, not so much the pressure, but definitely the responsibility.
Yeah,
absolutely.
Yeah.
So
and so do you have before someone goes in for that type of surgery or testing or whatever, where do you get more pressure from the actual patient or the family members?
Well, I think that in medicine, you establish a relationship, or we say a rapport with that person, and you feel tremendous responsibility. If that person is putting their faith in you to return that, leave nothing out, you go 100%. And like I say to people before these procedures, we're just going to keep going. There's no time limit, so to speak. We're just going to try and do everything. And to some extent, it's also a balance between being successful, but also being safe. One of the main, I suppose, drivers of medicine is to do no harm. So we're always kind of got that in the back of our mind. But yeah, no, it's very much with the patient first and the family second.
Yeah. So interesting, man. And do you know what? When because what you do, it's you hear about people doing this type of work, but it's so rare that you actually get to pick someone's brain that that this is their daily gig. Like most people don't get to be cardiologists or actually get in there and help people in this way. And so on that, like at what point do you get your patients? Like, do you get them when they're totally fucked up and they're about, they're on death's door, or when do you usually get your patients? At what stage?
Yeah, it's a real spectrum, Tommy. Like sometimes, like particularly at the Alfred Hospital is like the centre for heart failure. So as you say, people's hearts were really screwed up, because the Alfred is the transplant heart centre. There's only a few in Australia, and the Alfred's been sort of at the forefront for a long time. So sometimes we get people in that situation. So, I've had like 15, 16-year-olds whose hearts just won't go back into normal rhythm, and they're literally being put on artificial life support. And then, you've got to get in there and fix their heart rhythm. And then with rhythm problems, it really can be quite dramatic in terms of how quickly people improve. Yeah, no, it's a real spectrum. And then other people who, feel their heart's going fast, or they feel really faint at times, or they feel really breathless. And then it gets picked up that it's because their heart's sort of jigging around. And then, so I'll see people at that stage as well. But, a lot of cardiologists mainly see an older population, whereas I see like a very even spread from, like 16, because I don't do sort of pediatric stuff, but, right through to people in their latter years. So.
And then when someone comes to you, what's the first question you would ask? Is it around do you eat well? Like how do you determine where they're at in terms of health?
So usually I start with, what brings you to me? Why become to me? Tell me whatever you want to talk about, and so that they can lead off, and then, also talk to them about what's really important to them, rather than what I might want to tick off, like, do you smoke, do you drink, all that sort of stuff. And then, also people have this fear sometimes with medicine that they've gone Googling, and we don't want to, it's like this secret activity, and they might find something that we don't know. But, that's another thing we commonly say, like, if you've looked something up on the internet, or you've read something or whatever, throw it at me. Let's talk about it. There's no secrets. It's a pretty special relationship, because once that door closes, it's just the two of you, or there might be a relative or whatever, but there's actually not that many opportunities in life when people can just say whatever they want to someone. And then depending on what the problem is, we might drill down into some of that lifestyle stuff.
Yeah, yeah. And what made you? Oh, sorry. I just gotta repeat there, but that's cool. No, so what made you land in a yoga class? Is it something that you experienced through work, and you said, you know what, maybe there's a connection, or what made you land in a yoga class and start doing that?
So there's probably two reasons. One was my wife Laura started doing it, and she got a lot out of it, and she was like, "You got to come, you've got to do it." And I'm like, "Oh, I'm a guy. I like to run, or I play a bit of water polo. I like that kind of full on stuff." And you have this sort of, I mean, you know all this, but people think that yoga is just kind of stretching and stuff like that. And one thing I'll never forget, Tommy, is during one of our yoga classes was, as you call me, like Rafa, right? I'm sweating like all over the place. And here's Tommy. This is how great a guy Tommy is. He comes and puts his hand on my soaking bag to make sure I'm getting the right form.
Yeah.
So it's a lot more energetic than what I was expecting. So that was one part to take the advice of my wife and do something with her, which has been really cool. The second aspect is that in the last sort of probably 10 years of heart work, we've sort of started to think a little bit more outside the box. So I suppose classically in medicine, we think about pills and procedures, operations and tablets, rather than thinking, well, how can we change people's lifestyle? There's a lot spoken about how, the proportion of, nearly 2/3 of people are overweight in Australia, right?
That is scary.
Yeah. So, and for decades, doctors and others have banged on about diet and exercise. But it's really, really hard for people. So, part of it's just kind of getting a bit of an interest around the importance of that. And yoga is actually a great form of exercise. And there's been just a couple of papers coming out in the literature now looking at the role of yoga in some of the heart rhythm problems that I deal in. So, but nothing sort of concrete. So I wanted to kind of explore that more. And if you're going to ask a whole bunch of people to do something, then if you've got some knowledge of it yourself, then that's a huge head start.
Yeah. And then so you actually did a review, and you released, you're in the Herald Sun, which is one of the major papers here in Melbourne, Australia. But and the only reason I say that is because we've got listeners all over the world. But you
Cool.
just recently did a review of the stress and atrial fibrillation, if I'm saying that correctly. But can you tell us more about that review, which was sent out, and it was quite a pretty full-on review, wasn't it? It got sort of sent to all the major cool places for heart doctors and stuff around the world, huh?
Yeah. So what that was about was talking. So atrial fibrillation is this irregular heartbeat. It's the most common heart rhythm problem, and it's a major cause of the heart not beating properly, or what we call heart failure, and also stroke, particularly in older people. And what this review was about was that interaction between stress. So I would say to over 50% of people I see whose hearts are playing up, they say, "Oh, I've been really stressed." And then the flip side of it is that when your heart's sort of jumping all over the place, you feel stressed. So it was obviously aimed at cardiologists, but just to kind of bring up that relationship, talk through that relationship, appreciate that relationship. Because more than 1/3 of people who have atrial fibrillation are actually depressed. And a similar proportion are anxious. And we did a study which showed that about 20% are actually suicidal.
Oh.
So, unless you bring that up, like the number of times I'll bring up that sort of, how you've been feeling, if you've been depressed and all the rest, and suddenly people have got tears in their eyes. but, you know, and then it comes out and we talk about it and, you know, hopefully make a difference.
Yeah, yeah, yeah. And so, because it is so interesting, and you would have noticed this too, but, well, I guess because of what your job is, it's a pretty full-on job, and you have a lot of pressure and responsibility to, I guess, to be a good fucking doctor that's being of service to the community, you know? And so did you ever get to that point where you were sort of just feeling stressed and anxious and you just got too deep into the stuff?
Yeah, I suppose, you know, as much as we don't like it to happen, like every now and then people have a major complication as a result, and that is the most stressful. Because, you know, like we were talking about early on, you've got this responsibility, you've taken this responsibility, that person's trusted you, and things haven't worked out, you know, the way. And it's, you know, to some extent, it's your fault, you know, your responsibility. So I would say they're the most stressful times, but that, you know, that's when you kind of settle down and then you're shifting focus. So it's, you know, I suppose in medicine, it's never about it. Well, it shouldn't be about the doctor. It should be about the person you're looking after. So, you know, you shift it back and, okay, well, how can we minimize this? How can we get, you know, that person better? And, you know, we call people and it's all hands on deck and you explain everything, you know, this is what happened and you know, honest and then ultimately things work out.
Mm, mm. Well,
But
you know
that's,
what?
yeah, they're the most stressful times.
Yeah, yeah. My uncle lives in LA, and he's a gynecologist. And
Right.
I think I told you about him. He's the guy that
Yeah.
just had the triple bypass or
Bypass.
whatever. He, by the way, he's all good. He's rocking it.
Great.
He just walked 2 miles, so
Wow.
he's rocking it back. But I last year he had a situation where he started. Well, he's been doing this for ages, but like, what's the stuff when you whack the thing and the fat comes out? What's that stuff called? What's it called again?
Oh, liposuction.
Yeah, like, so he started doing liposuction and doing boobs and vaginal
Oh,
rejuvenation and all that.
oh,
Anyway,
okay.
so he was doing the liposuction, and one of his patients literally died on his bed. And he, through that whatever 6 month period, he was just a total, like, I can't even imagine what that would feel like. And it was and I remember him telling me how stressful that was, like nothing
Mm,
sort of made sense, and it was just like, wow. And you question yourself as a doctor and whatever else.
mm.
So that would be, you know, like, obviously for me, if I go to a yoga class and I fuck up a yoga class, it's very different than you than what you guys would have to deal with. So, you know, a great deal of, I guess, empathy there, because it's real. You know,
Yeah.
you've got people's lives in your hands. So I guess it's that next level of you know, knowing what you know, and building your knowledge, and just always having that thing of being of service to others. But then, you know, that sort of leads also on to where you're going to now, is being of service to yourself, you know, where you look at your body and you look in the mirror, and if you're in your, you know, 30s, 40s, 50s, 60s, whatever, and you're a fat fucker that's eating chicken and chips every night, and you're not exercising and whatever, I mean, what do you expect is going to happen, you know? So,
Yeah.
you know, I mean, is that true? I mean, have you known people that have treated their body like absolute shit, been totally stressed, and had a healthy heart?
Well, I suppose, yeah, we don't we don't see those guys, but yeah, there's definitely people that have abused their body and seem to get away with it, you
Mm,
know. But you know, the flip side is that a lot of the people, particularly when it comes to the heart attack stuff, the blockages of the arteries, you know, that disproportionately, you know, those guys will be smokers or those guys will be overweight. And with overweight comes diabetes and high blood pressure. So yeah, some people get away with it, but
yeah.
the odds aren't in your favour.
Mate, I'll tell you what, the cigarettes for me, it took me, because I don't know if you know, but I used to play in bands and whatever. And the only thing that I
Well,
brought with me after that was the cigarettes. I'm like, nah, fuck it. I'm going to be a rebel. I'm going to stay. So I used to go teach yoga classes, and then come home and smoke my durries, sit at home smoking durries. And I actually quit it's almost like a year ago. But I genuinely feel, I feel that my heart is actually happier that
Yeah.
that stuff is not being chucked in my body 20, 30 times a day. And yeah, I mean, so on that, this whole idea around reducing stress and finding things like yoga and meditation and mindfulness and whatever else, if we really look at that, has it actually been proven that that reduces AF or EF or whatever it is, the atrial
AF, yeah.
AF, yeah, atrial
Yeah.
fibrillation, and these rhythmic problems that people have?
Yeah. So I think that, like, this whole concept of proof and research and things like that, it's actually really complex. When you say, has something been proven? Like, I know nowadays, particularly with COVID, right, and vaccines and stuff like that, people want to do their own research. But research is actually a whole skill set, right? Because you got to know what the level of evidence of something is in terms of how proven it is. So in medicine, the way it kind of rolls is that firstly, there'll be an observation. So classically, we look at big populations of people and we go, okay, well, people who smoke seem to have more heart attacks. And then the next stage, we might go, okay, well, let's grab a bunch of people and say, okay, you guys stop smoking and let's see what happens in terms of the risk of them having heart attacks. And so, and then that takes us up a level of proof. And then the absolute gold standard is where we grab a bunch of people and we randomly assign them to either keep smoking or stop smoking. So that then we're looking at a similar group of people and then we look at the outcomes. So that's called a randomized trial. So a bit of a long-winded answer, but with the yoga and AFib stuff, and what I'm hoping to talk to you about down the track, is that we haven't done this randomized study. So there was a study, actually one in India, one in the US, which had around 50 people, and they got them to do 3 or 6 months of yoga, and then they stopped their yoga, and they found that the people that were, when they were doing yoga, had slightly lower blood pressure, slightly lower heart rates. They dealt with their AFib a bit less, and some of them actually had less AFib. So it's definitely going the right direction, Tommy.
That's super exciting, and we've been talking about doing this thing together with this study to actually prove that that's what we would be working on, to actually prove that this shit works.
Yeah.
And you know what's funny? Like, even as someone, I've seen this with my own eyes, with people in yoga classes, and I've had people come in, and one of the greatest things about being a teacher is when you've got, 20, 30 or however many people in your class, within a millisecond, you sit up the front as a teacher or as someone that's guiding the practice, and you could call out without a doubt the people in that class that are stressed beyond any mean. They're fidgeting, they're moving around, their faces all scrunched up, their shoulders are up, and it's like, you can tell, you can literally tell. And the way that I look at the world, if I have 1, 2, or 3 of those people in the class, I basically teach to them. I'm being of service to them, and the funny thing is when usually when you teach to the way I say it, the most fucked up person in the room, which is usually me, so the person outside of me, is when I teach that person, it filters out, because that as they open and whatever, then the rest, everyone else gets their benefit too. But what I do notice every single time, not even 9 times out of 10, but 10 times out of 10, is after an hour of yoga or even 45 minutes of yoga, they look totally different.
Yeah.
Their face changes, their body color changes, their shoulders are soft. You can just tell, and I've even seen, extreme cases where people have had an anxiety attack in my class. It's happened like 2 or 3 times. And even in those times, the only thing I've done is I've walked over, I've put my hand on their heart, and I just said, breathe. Straight within 10 seconds, they're supported, they feel safe. It's like, okay, cool, I'm not going to die. You know, so it is these practices, I've seen them make a difference in people's lives, even just from one class. And I guess from your angle, is there like a level of excitement for you that you're like, wow, there could be a different angle that we can come in with here?
Yeah, I love that. I love the concept of a more holistic approach to looking after someone. Yeah, no, I think super exciting. You know, I think one of your things is getting more guys into yoga, right?
Totally.
And as
Yeah.
we saw this morning together, you know, it's just you and I down there,
It's
right?
you and me. It's like, hey, bro, how are you? Yeah.
Brothers in arms, you know.
Totally. Yeah. Yeah.
Yeah, I think that'll be a great challenge for us as to how put this together so that the people, you know, don't just turn up for the first few weeks or whatever, but, you know, stick at it. And
Yeah.
it's going to be cool.
Yeah. Yeah. And what about, you touched on this whole thing around Googling and doing your own research and the vaccines and whatever else. Like, I mean, it seems to me, regardless of where you've landed, or anyone's landed, it seems to me that everyone's become an expert.
Yeah.
It's like,
exactly.
oh, well, you're doing, oh shit. Or it's like, oh, you haven't yet. Oh my God, what the, you know, it's like everyone's knows so much about vaccines these days. It's actually quite comical. So look, without it going into one camp or another, you know, what's been your sort of experience in that? I mean, you can go into a camp if you want, up to you, but it's like, what's been your experience about that whole storyline, I guess?
Yeah. Well, I suppose that it's been, I mean, it's been so hard in so many ways, but because things happened so rapidly and it was so dramatic, you know, like it was literally the war of our generation, really. I mean, and that was just really hard for people to take in. I think what was pretty amazing was that from a medical perspective, that if you put all these resources, you know, financial and get all the brains on a job, like to come up with vaccines so rapidly, you know, it didn't actually really happen over 6 to 9 months. It had been happening over years with some of the, you know, the viruses before that. You know, was pretty amazing to come up with that tool. And I mean, it's had an enormous impact, right? So now, people, you know, the government and things can be a little bit, you know, slacker, if you like, and say, okay, well, you know, we can take off masks here, the kids can be back at school, we can go to restaurants, we can sit closer together, we can go back to yoga classes in person. And that's predominantly, you know, on the strength of a high vaccination rate. So, you know, and look, unfortunately, with any treatment in medicine, you know, whether it be pills or an injection or an operation, like we were touched on earlier, some bad shit can happen too. So, you know, so if we want to, you know, talk about the heart side, you know, there is this condition called myocarditis, which is an inflammation of the heart, which can happen with some of the vaccines. And before that, you know, there was a lot talk about the AstraZeneca and the blood clotting. And that, you know, that's bloody scary, you know. And so naturally people go, well, shit, I reckon I'll be all right if I get COVID. You know, why should someone tell me what I have to do and inject into my body? So I definitely get all that. I suppose the flip side, and from a medical side, you know, we just all get vaccinated. You know, we have our flu shots each year. We kind of believe in the science. But, you know, I get, you know, people from sort of that aren't in that kind of space and don't have that background, you know, they might be a bit more skeptical and they don't like people to tell them what to do.
Yeah. So you've definitely seen an uprising in terms of the heart, but is that just because more like everyone's gone out and got jabbed and whatever? So that's why you're probably seeing an increase in the myocarditis, carditis.
So, you know, it's sort of somewhere around the 1 in 100,000 or 1 in 10,000. What we've seen a bit of is chest pain. But then when we've done the test for this myocarditis, you know, it's actually really, really unusual. But there has been a bit of chest pain afterwards. There have been a bit of rhythm problem afterwards. And you know, as I'm sure a lot of your listeners who've had some of the vaccines, you know, sometimes you feel like garbage for 24 hours or longer afterwards. And that's because the vaccine's actually creating this inflammatory response. That's the way it rolls. That's the way it works. So, you know, unfortunately, sometimes there is a little bit of a price to pay, but at a community level, right, you know, if we're all going to be safe together, it's the jab.
It's the jabsies, man. And then the other thing that I want to ask you about was around, there's been so many, but there's been like, I don't know if it's just been in the news or whatever, but there's been like at least 4 or 5 people over the last couple of months have literally just dropped dead. Like Warney, who was the other cricketer? Rod Marsh, I think.
Yeah, Rod Marsh, just a few days before.
A few days, and you just sort of go, why? What's going on here? You know, what? So, and we touched on it before this morning, off air, but you know, with Warney, like what? How does that happen?
Yeah, so I don't know whether anyone knows the specifics of Warney's autopsy. But so if we talk more generally about why people drop dead suddenly, and so the heart's obviously a big reason. You know, one of the other big reasons is the brain. So people can have a bleed into their brain. They can have an enormous stroke, which can be very sudden. But from the heart side, about 70 or 80% of the time, particularly once you're over the age of 40, it's due to a blockage of your artery. And what we haven't worked out yet in cardiology is, why does a person whose artery suddenly blocks, right? So the arteries are these pipes that run on the surface of your heart muscle. So heart's a big, strong muscle. It suddenly cuts supply. Heart doesn't get any oxygen, doesn't get any blood. Some people don't even know it's happened. So they'll have a test a year later and it's like, oh, you had a heart attack. And it's like, oh, you know, didn't know that. Some people will come in with that classic chest pain, feel like rubbish, breathless, sweaty. And then some people will just drop dead. And the reason they drop dead is that some people's hearts respond and they go, like we talked about, atrial fibrillation. So that's the upper chambers of the heart, chaotic, irregular rhythm. Ventricular fibrillation is where the bottom chambers, chaotic, abnormal rhythm, no blood to the brain, and then, you know, within a few minutes, if you're not resuscitated, you know, you can die. So, so that's the most common situation in, you know, people over the age of 40.
Yeah, and so with Warney, do you know about his autopsy results? Have you? No, you don't. Yeah. So you just don't know what.
Correct.
Yeah.
So I suppose what's been fairly well accepted about Warney, and comes back to your great work in giving up the darts. Yeah. Was, you know, that he was a smoker. And
love the durries.
Yeah. And you know, that probably sticks out in terms of, you know, well, how to respond to such a tragedy as Warney going, well, if you smoke, stop. Yeah. Well, I mean, I can just tell you from my personal experience, you know, stopping for the last year, well, not even stopping, just being a non-smoker for the last 12 months. Like, I've started running, everything's changed, my skin's better. The fucking stink of that thing is crazy. Like, you know, you don't realize how much that thing smells. And that was actually one of the reasons why I quit. Like, I was feeling like, obviously I didn't know what great was till now, but you know, you don't realize that you walk into places, and even if you've done all the things to try and cover up the ciggies, the smell, like, people smell it. And it's almost like, you know, you just get these weird looks. It's like, oh, you're a smoker. What the hell? You're in your 40s. Yeah. What are you doing? Yeah. Like, stop it. And so, you know, what with all this stuff and with all the work you've done and all the experiences you've had, what would you say, Peter, has been the highest achievement for you? And this is personal, like not as in accolades or whatever, but just the highest level where you sort of sat in your chair and went, holy shit, like, that was unbelievable. I think that, you know, looking after people and like, sometimes when had an interaction with people or done, one of these, what are called ablations. So this is where I put the little tube in and do the burning inside the heart. And sometimes, it's just such a dramatic change. And you see that person, 6 weeks later come through the door and they look different. And like you were saying, they suddenly got this glow and then, they come in, you close the door, how you doing? And then just tears, right? From 60-year-old bloke, is usually like, stiff and tight. And it's just like, that is definitely the pinnacle. Like the research stuff's great and all the rest, but just that, that personal feedback and making a difference in someone's life is very cool.
Yeah. And so where, like, if you had all your ducks in a row and everything lined up, what would you create in your field over the next 10 years?
Well, I think it would be really cool, and we're all already sort of in this direction of just giving people options. So we often start with pills and then we have procedures, but bringing it broader. And some of it's not stuff people want to hear, like we've already been talking about. What we haven't spoken about, which is really relevant to AFib, is booze.
Is what?
So, booze.
Booze, right? Yeah.
Which unfortunately, it's not great for the rhythms of the heart. And then the weight loss side, but it'd be really great if we could have this much more holistic approach. And then the yoga and the regular exercise and the mindfulness and all that. So we kind of bring this much broader. And I think that's important because some people are very shy of Western medicine because big pharma and all the billions of dollars that that these companies make out of medicine and doctors and all that thing. So if they can kind of come in and see that we're kind of trying to think as broadly and also tailoring it to what people want. It's not about what we want or what we think you should do, but these are the options and trying to mold it and individualize. I think that'd be cool.
Yeah. I mean, look, in all honesty, in terms of yoga, and you probably experienced this as well, yoga, mindfulness, any type of yogic tradition, meditation, even just moving the body. I've really, especially over the last 12 months, I've been really testing this shit out. Like, for example, when I got COVID on the way home earlier in December. And by the time I realized I had it, I was pretty much on the plane. And, I was heating up and I had temperature and whatever else. And we're on the way home and we probably had 6-7 hours to go on the plane. And I'm just sitting there full heating up and my temperature's going off. And I'm like, you know what, Tom, you've been harping on about this shit for fucking ever. You talk about breathing, you talk about mindfulness, this and that. So at that moment, I actually tested myself out and I sat back in the seat and we're flying business. So I put on the flatbed and I sort of lied back and I just started doing this breathing that cools down the body. And I did it for, I think it was like 2 hours. All I did, I just closed my eyes and I was doing this cooling breathing technique. My own experience, first time ever where I actually went, holy shit, this stuff works, because I needed it as medicine. My temperature went way down. I went back to normal temperature. Yeah, I felt it, and it was the only thing I changed was I did this yogic breathing to cool the breath down. Other stories where I've done stress, whether it's an argument with your girlfriend or partner or whatever, stress to the fuck house. I feel like the whole world's against me. I'm not going to amount to anything. My head's going crazy. What do? I come in and do some Kundalini yogic breathing or some Kundalini yoga where it's quite vigorous. And the shit works. You finish and you're like, oh, I'm clear. I'm back to my normal self. So I get it. It's so much easier to go to the medicine cabinet and drop a
Yeah.
couple of Panadols. But this is the future. Like, it has to be, because like we've got these tools and they make you feel way better than a Panadol, 100%.
Yeah, I mean, and we kind of, so what yoga can do is it can get into the autonomic nervous system. So you know, you got your voluntary and you've got your involuntary, and so your involuntary nervous system is called your autonomic nervous system, and that's the classic sort of flight fright. So stress, pupils dilate, you start sweating, your heart rate goes up, you breathe more quickly. What yoga can do is flip the switch the other way, and that's exactly what you were just describing on your business class flight, Tommy. You know, about, you know, so it's pushed towards what's called the parasympathetic nervous system. So it slows your heart rate, just it can, yeah, drop your body temperature, reduce your blood pressure. So absolutely, yeah, there's a scientific explanation for that.
And then, so with listeners, regardless of how old they are, male, female, whatever, at what point, because, you know, I don't know, I'm definitely like this. Like, if I feel something in the body, straight away, I'm like, I got cancer, I'm going to fucking die.
Right.
You know, so, and then you just got to, you know, you just got to remind yourself, as I do, just go to the doc, see what's going on. And if there is something, we'll deal with it. But at what point would you say to people, you know what, just go to speak to your doc?
Yeah, I think if something different happens and it's not clearly explained. So I suppose from the heart side of things,
Yeah.
it's when you start getting, like, let's say you're doing your exercise and you're just getting a bit of a sort of funny discomfort in the chest. That's a really scary one. So that one needs to be jumped on. Or, you know, if your exercise tolerance suddenly drops, so suddenly, you know, stuff like you could run 5Ks and you're getting breathless at 2Ks, you know, that's often a worrying sign. If people are having sudden sort of lightheaded episodes, obviously a blackout, or if they feel their heart just suddenly take off, you know, I suppose they'd be the classic warning signs from a heart perspective as to when they should go and see their doc. And then sort of don't, you know, you can do your Dr. Google and all the rest, but you know, bring it up with the doctor and say, oh, look, I read about this, reckon I've got this. You know, we don't mind, throw it at us.
Yeah. Yeah. And then, so what is it actually easy? Like, if someone just, I don't know, this is a dumbass question, I guess it's just maybe just for myself, but if someone wants to just go, wonder if my arteries are blocked, can you just go and get it checked out?
Yeah, that's it. No. Short answer is yes. So there's this CT scanner now that you can have that gives you like a virtual angiogram. So an angiogram is where we stick a little tube in the artery somewhere. We used to stick it in the leg, now we can stick it in the wrist. But nowadays you can just have an injection in the vein and they can do literally see all the plumbing around your heart. So the blood vessels, and see if there's any blockages. Now, you know, one of the tricky things about medicine is how you distribute your resources. So if every sort of 40, 50-year-old plus came in and said, I want to get this scan done, which is about $500-600, you know, does the health system cop that, or do you offer it to people and say, okay, well, look, if you really want to know, you can pay for it? So yeah, short answer is yes. It's not offered. We only actually offer it to people, if they've got sort of symptoms that would suggest that, or we think it's going to change how we look after them. So for example, someone comes in and their cholesterol's 7 or 8, and we're going, oh, well, are we going to sort of focus on the cholesterol side and stuff? Well, if we know that they've got some sort of early blockages, then we'd be more likely to. Or, you know, if their arteries are clean, then we'd probably be less likely to. We might say, okay, get onto the diet and stuff and see if we can get it down that way.
Yeah, it's so, because there's so many people, I reckon, walking around, and I've had this in the past as well, where you know something's a bit out of whack, you know, and you're just like,
Yeah.
but then it's so dumb, because you're just sitting there with it and you're carrying this shit with you. And this, when I hit 40, that was, when was I, 42, 43, but it was 43. So it was like a year and a half, 2 years ago, where I just went, Tom, like, just go to the doc and just get an all-round test. And I went, everything was fine. I was like, oh, my cholesterol was a tiny bit high. But then she's like, all right, do this, da, 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 da. And we sorted it out, you know? So it's that thing of you just want to actually get there and get it done.
Yeah.
Just, yeah.
And I think, like, it just gives you a lot of headspace too, right? Then you're not worrying about that. You're not sweeping that shit under the rug, so to speak.
Yeah, exactly. and so what are we with this thing that we're going to move forward with these, or what are we actually going to do, Professor Kistler? What are we doing? So we're going to, what's the idea around it? So we're going to get a bunch of people in there. Talk us through what your idea is. Because you've actually put a request into the government thing, right? Yeah.
So the main research funding body in Australia is called the National Health and Medical Research Council, or NHMRC. So what I put in is this proposal to look at yoga as one of the aspects of treatment in people with this AFib, this atrial fibrillation. And what we want to do is that sort of what hasn't been done ever is what's called a randomized study. So we're going to take a bunch of people with AFib, and half of them are so it's a random selection. So we have this computer generated program. You punch in the initials, and the computer says, okay, you're doing yoga, you're not doing yoga, and otherwise their treatments are exactly the same. And we're going to follow them for 12 months and see if it makes a difference to a couple of things. One is their AFib, so will they get less of it? And perhaps just as importantly, how they feel in response to it. So we talk about quality of life, and there are all these sort of measures or tools where we work out someone's quality of life before and the impact and their ability to deal with their AFib down the track, and how often they end up in hospital if they're doing yoga versus not doing yoga. So AFib is actually one of the 10 most common reasons people go to the emergency department.
Crazy.
And then if that all comes out, then, yoga could be potentially become part of what are called guidelines. So in just about anything in medicine, we have like these guidelines where the so-called head honchos, if you like, sit together and they go, okay, a person comes in with this condition, then these are the sorts of things that you should be offering them and talking to them about. So that's the kind of the ultimate step.
Yeah. So what would that mean, that at some point hospitals will have yoga rooms?
Well, it's like, going back to your sort of music days, like there's music therapy in hospitals now. So, would they have yoga rooms, or would it be some kind of online program?
Online thing,
you know more about that than me in terms of how best it works. So, and it probably wouldn't be in hospital, it'd be, because we want it to be when people leave hospital.
Exactly. Yeah. So, yeah. And then, so how cool would that be? So you could actually prescribe yoga, or you could prescribe breath work, because there is so many different ways of looking at that. Even with breath work, some breath work is so intense that I'd say that people that have heart issues and heart problems shouldn't be doing the intense stuff anyway. But there is, these really gentle, same thing with yoga. You can go into it gently, or you can actually go all out, as you've experienced in my classes. Very cool. Very cool. Well, I don't know, Professor Kistler, I reckon it's been epic having you on. I've learned a lot, and I guess before we finish up, the only other thing that I wanted to talk to you about is around, especially with the heart, and specifically with the heart, is in terms of mindfulness and the heart. When you work in this field of whether it's yoga or meditation or whatever, you actually feel the energy of the heart. Like you feel these it feels healing after you've done stuff. Or best way I can explain it is after you've had a massive cry, you
Yeah.
feel free, especially around the heart space. Everything opens up. Um, is there, I don't know, what is that? That's basically what I was going to ask. Like that relief, does the heart actually become softer? Does it just, what happens when you feel relief and you feel the energy of relief?
Well, I think there's a bunch of components to that. I think part of it is, so like we talked about, heart rate maybe coming down a little, blood pressure coming down a little. So that's releasing that tension. Then there's the kind of the muscles of the chest, just relaxing a bit. And then there's obviously the mind itself,
Mm.
and so I think it's probably a combination of all three, Tommy.
Yeah, yeah. And so before we finish up, is there anything in you that you believe people really need to hear around, well, yeah, whether it's AFib, whether it's heart stuff? Is there anything that you believe the community really needs to hear?
Yeah, I think that if you're worried about something, just go and get it checked out.
Mm.
Just go and check it out. And I think also just have a really sort of honest conversation with your doc. Don't hold anything back, and ask all the questions you want to ask. And I think the other thing is look after yourself, and do, you want to keep yourself sort of mentally and physically fit, and find something that kind of works for you and your lifestyle. Like, dare I say it might not be yoga, but keep yourself moving. All the little things like, park a little bit further from that cafe or shop you want to go. Just say you walk a bit further, and so I think find stuff that you kind of enjoy, and don't ignore stuff.
Don't ignore stuff. That's a big one. Don't shove the shit under the carpet. Love it, Professor Kistler. Well, man, it was so good having you on the show. I've learned a lot, and I know all the bullshitters out there have learned a lot as well. So it was an honor. And obviously, I mean, what would you promote? Someone like, I mean, you wouldn't promote because you have half of Melbourne going, "Hey, Dr. Kistler, what's going on? How's my heart?" So you obviously don't want that. But I guess if you ever end up in the offices of Professor Kistler, you're a fucking lucky man or lucky woman.
That's very kind, Tommy. It's been a real pleasure to chat with you and all your listeners. I've really enjoyed it. Thank you.